My name is Dr. Robert Oliverio, Bob Oliverio. I'm the Chief Medical Officer for Ambulatory Care and Population Health, and I work for Roper St. Francis Healthcare. Well, the citizens can help us by just keeping an eye on themselves and, the things that we ask people to look for, if there's any concern, is really, number one, if you have a fever, number two, a cough, or number three, shortness of breath. The combination of those three, really what we'd like people to do is to get in touch with our virtual healthcare. And so there are a lot of things that people can do if they're concerned. Number one is talk to that provider. Number two, if the provider says that you need to be evaluated, we have areas within the Low Country, one on James Island and one close by on University Boulevard, where we're seeing people who have influenza or flu-like symptoms. And so they'll direct you through, evaluate you, and then give you next best steps. The other thing is, if you have medical problems, or if your shortness of breath is really bad, you're vomiting so you can't keep down fluids, that may be a good time to maybe seek emergency care, and our emergency rooms are equipped to help. If you want to go to an emergency room, it's best if you have the number to call them in advance, particularly if you're concerned about COVID. But really, it's a matter of if you have the concern, reaching out and getting good advice. And there's plenty of good advice, particularly through virtual care. That's the first step. Well, flattening the curve is really decreasing the spread of disease. So the curve is basically the number of cases that are in the area. So if the caseload goes very high quickly, and then that curve is going to exceed the amount of medical capacity that we have. There'll be too many patients for beds. And that's one of the reasons why the strategy that the mayors have come out with, which is social distancing, washing hands, staying safe, staying away from crowds, that decreases the spread and decreases the rapidity of those cases coming into the medical facilities. And so that's what flattening the curve is all about. Even if this becomes widespread, if we can slow the spread over time, we won't overwhelm our medical capacity. There's a lot of talk out there. There's a lot of folks that will tell you things about COVID-19. There are very reputable sources of information in the community, and the hospital systems are trying to get that information out as much as possible. Websites are up, and make sure you go to our website or MUSC's website. There are multiple areas to get good information about COVID-19. You don't have to make ill-informed or uninformed decisions. There's a lot of ways to get information, good information, to help you make the best decision for yourself.